Now, when we talk about the global conversation about health at this point in time, and many doctors across the world are voicing their concerns that as we try to deal with this ongoing pandemic, many other diseases will go unnoticed, and their risk of them spreading or the risk of them becoming worse will continue. We're also seeing many people across the world miss out on vaccines. Is that also a concern that you share?
Healthcare systems and the funding that goes into healthcare is of a limited supply. And as it gets pushed into responding to COVID-19, that can mean there's less attention and less funding remaining for other issues. Around HIV, the big concern is about getting patients their medications. Is that like, how will they continue to access their medications under circumstances where they may not be able to easily access healthcare facilities or travel freely out of their homes?
Right. With all those problems, what do you think we do now to move forward? Because we know that this pandemic is not going to go away anytime soon. We don't know, we don't have any date on a cure, a vaccine, and we need to learn how to move forward with keeping it in mind. What policies do you think need to now be implemented?
So I think you're absolutely right that we need to think about this as a long haul event that we're facing, that this isn't something temporary. This is going to something that's going to take months or years before we see real change around COVID-19. So once you've accepted that situation, how do you respond to it? So you have to start thinking, how can we make sure that people can still get their health care even when there's this risk of this transmissible disease? And that might mean changing the way, waiting rooms are, so that patients aren't mixed together when they're waiting for healthcare, changing the way healthcare providers protect themselves. And it means about thinking hard about the financing and the money that we put into our healthcare systems and making sure that we compensate for the impact of COVID-19 by adding additional budgets for healthcare, because you can't stretch the budget that you already have to cover this whole new crisis without something else getting lost.